The reality is that pelvic PT in 2026 is still absolutely a privilege. There has been a lot of discussion, yapping, if you will, online about the realities of our profession, the future of our profession, how or the way to become a pelvic physical therapist, what that entails, what that should allow individuals to do, and then the way that we can advocate for our profession going forward. And I love that these conversations are happening in professional spheres. I think it's super important. One of the ways that I feel like social media right now has really drifted has been in the true reality right now of access to pelvic PT. I would absolutely love that every pregnant woman had access to pelvic PT. Every postpartum woman had access to pelvic PT. Everyone with any pelvic floor dysfunction had access. That you would, if you had prolapse and required a pessary, that you had someone nearby that could provide a pessary, do a fitting for a pessary, and allow for that trial and error process that can often happen for pessary fitting to find the one that works best for you, your anatomy, and your lifestyle. The reality, though, is that most people, I don't know what percentage, but a significant amount of women cannot afford you. When the estimates are somewhere of 60+% of pelvic PTs are cash based. And I get it. This is not to say that I do not want pelvic PTs to get paid and get paid well for what they do with a doctorate level education. But cash based PT is inaccessible to many. Like, let's look at pregnancy and postpartum. When there is no paid maternity leave in the US that is guaranteed. And even in Canada, you have 12 months of maternity leave, but it's often at 55% or blended. With the way that of the world right now and cost of living, etc., having a bunch of extra money for pelvic PT for many people's budgets and bottom lines is just not accessible. It's just not something that they can afford. And mothers, they often are the ones who make those sacrifices, right? And so that reality means that they are going onto the internet for that information, because if they can't access in-person, nuanced, clinical one-on-one care, they're going to at least start trying to find trusted providers on the internet. The other reality is that we still have major areas of deserts for pelvic PT. If you are in a big city, you probably have way more people who are providing outpatient or community-based pelvic floor physical therapy, but many more rural areas don't. Pessary fitting, while in the scope of pelvic PTs, there are far less of these humans that are fitting for pessaries. There is a trial and error. So again, there's this like cost component to it. And in Canada, a lot of Urogynes do it, and there's wait lists that can be upwards of 18 months to get in to see a Urogyne that specifically does pessary fitting. And so there's the part about cost, and then there's a part about access. And again, when that is the case, most people are turning to the internet. This became a really big topic of discussion, for example, when we were doing the International Delphi Statement for the return to exercise postpartum and trying to create this contraindication list, or this gold standard for return to exercise in the postpartum period. And many pelvic PTs spoke to the fact that they thought it should be a requirement for a person to see a pelvic provider before they are going to return to exercise. And we kiboshed that for two reasons. Number one is the access and cost. It's hugely prohibitive. And the second part is the reality that a lot of people are, if they just start reconditioning in the postpartum period, their pelvic symptoms will start to improve as their body normalizes. And they may not need to see pelvic physio, right? And so that is why in the postpartum guidelines, we say if there's an exacerbation or making worse of your symptoms with moderate to vigorous physical activity, then it is indicated that going to see a pelvic floor physical therapist would be helpful, useful, and would be a good recommendation. Where this kind of leads me is that I put up a post last week from the time of me recording this, and I used an emotional hook. These 3 activities are ruining your pelvic floor. And I talked about how this marketing trend, this marketing strategy is actually really detrimental, and how a lot of times when people come into my office, there's a lot of undoing. Nothing is being ruined. You are not sabotaging. It is not your fault that you did a bicep curl 2 weeks postpartum. That is not why you have your prolapse. Like, these narratives, or the way that these narratives are interpreted, are harmful. And when people get to see me in the clinic, I get to start to undo some of that. But the reality of pelvic PT in 2026 is that for many, that is their only source of information. And so if you are sensationalizing, if you are minimalizing, if you are not telling the whole truth, or you are kind of trying to do it in snapshots and then say comment, guide, and putting behind a paywall, I'm not trying to belittle you trying to make money online. That is not the case at all. It's just the information that is forward facing to the patient. You're not going to see the people that potentially interpret that incorrectly or now blame themselves for their existence in their body or their new state of being because of something that maybe had nothing to do with the exercise that you said was ruining your pelvic floor. I'm going to finish up this conversation with a story. I was just at the Canadian Physiotherapy Association Congress, and I was speaking to some of my research that is currently in peer review, looking at fear of movement and fear of the pelvic floor and abdominal wall for women who exercise in pregnancy. And I was talking through some of our findings, which I cannot disclose just yet because it isn't published, but we were talking about how the fear of dysfunction postpartum from how you exercise in pregnancy is very pervasive online, especially for those who are getting information from healthcare providers and exercise professionals, particularly online. And I had somebody come up to me, she was in her 50s, and she said, that was such an interesting conversation. I have a mild diastasis recti, and I always blamed my exercise as to why that happened. And now I'm kind of rethinking that. And maybe it was just my anatomy or the way that I held or my anthropometrics that kind of changed the way my abdominal wall looked postpartum. And she had held on to that belief for 20 years. Now, I don't cast blame of who gave that recommendation, because that is what we thought back then. But it just shows how internalizing some of those messages can be, and how important it is for us to reflect on the way that we are showing up online, even the way that we are educating with our patients. And we're not going to get it right. Like, this is a hugely difficult skill, and it's the balance of like trying to grab attention on social media versus the art of nuance. And unfortunately, nuance doesn't do as well. But podcasts like the Barbell Mamas that I'm on, Substacks like this, and other long form media like YouTube are exploding, I think, because people are getting really frustrated from trying to distill their very complex healthcare history into a 30-second reel. So lots of discussion continuing to happen. Really excited to see that it is still occurring, and excited to see where the conversation goes from here.